3 years ago, Medicaid renewals were paused due to the COVID-19 public health emergency, allowing for SoonerCare members to have continuous coverage without an eligibility review. Well, now that the public health emergency is over, the Oklahoma Healthcare Authority says it's doing everything it can to make the transition as easy as possible.
The federal government back in December passed a bill that required continuous coverage to end April 1. So all 50 states are going through this, so we're not alone, but we've been working on this for quite some time to be prepared.
The public health emergency for COVID-19 expires in May, ending continuous Medicaid coverage. And the Healthcare Authority says around 300,000 members are no longer eligible for SoonerCare. Secretary of Health and CEO of the Healthcare Authority, Kevin Corbett, says disenrollment will happen over a 9-month phased approach.
We are going to be very thoughtful and compassionate about what our members are experiencing today and look to those that are most vulnerable such that we can continue coverage for the longest period that we can.
The goal, keep those with chronic health conditions or young children or currently receiving care covered as long as possible. However, those who are no longer eligible include adults over the income limit, without kids under 5 years old, or who have already found other coverage.
We're going to be continuing to evaluate members' coverage and communicate with them starting last week when all members that we believe are ineligible today received a communication from us recognizing that they are ineligible and the need for them to update their information.
Corbett says next month, ineligible members will receive a notice on when their disenrollment date is expected to occur. Another notice 45 days from the end of their coverage, then a final notice 10 days before they are disenrolled. He says they're also working to make sure those that are disenrolled have other options.
Other options including the federal marketplace today. We're working with the insurance department who have been great partners with us to make sure that there are other alternatives for individuals to have coverage. But we're still asking our members to make sure that all of the information we have is up to date and accurate. The last thing we want to do is disenroll someone simply because of the lack of information that is actually eligible today.
If you have questions or to make sure all of your information is up to date with the Healthcare Authority, visit the website mysoonercare.org. Again, that's mysoonercare.org. And for more Top 10 news, subscribe to the Governor's YouTube page and check out all of the Top 10 News playlists.